Hi everyone, this is Unit 1 Journal Entry for MN668 clinical course. Today I'm just going to do some introductory questions and answer the items in this introductory journal. So the first question is, describe your clinical experiences and mental health throughout the psychiatric nurse practitioner program. I would say that I have thus far seen experiences in both inpatient and outpatient, which was really nice. Inpatient being in the not typically a lockdown unit, but actually like what would be considered in the hospital. So in an acute hospital setting. And then also outpatient with both patients in clinic and also via telehealth. The ages range from pediatrics all the way to adults to geriatric patients. So I've gotten to see a good mix of all three thus far. Okay, what are the reasons you have chosen to work with this population, and are they solidified or have they changed? As far as the population that I like to work with, that would be either adults or geriatrics. That's my preference. I've worked long-term care, I've worked in a array of different settings, including endocrinology, where I've also been a VA nurse, so I've worked with a lot of patients of different age ranges, and that just happens to be the age range that I love to work with. And I seem to be most happy with working with. I haven't really changed that. I know working with adolescents and pediatrics, that definitely was eye-opening, just seeing like what they're dealing with, a lot of the issues as far as like the mental health realm that we're seeing in pediatrics and adolescents, but that did not change my mind as to my preference of the age groups that I would like to work with. I'm still leaning more towards working with adults as well as the geriatric population. That's just been the most rewarding for me in my career as a nurse, and most fulfilling. The next question is, discuss any concerns you have regarding this specific clinical course and working with the lifespan population for psychiatric mental health care. Thus far, I don't have any concerns. I feel like as each clinical course has gone by, I have improved my critical thinking skills, understanding how to do an initial assessment, looking at the tools that are being used, also medication management. I do enjoy going through that and looking at what's most beneficial for the patient, looking at disease processes to determine if their symptoms that they're seeing isn't being caused by something else that's underlying. That's always, I'm not going to say that's not necessarily challenging, but those are, things that you also want to evaluate, looking at their histories, family history as well. So I would say that as of right now, I really don't have too many concerns, but I feel like I'm always a person that likes to learn and gain new knowledge. So I just feel that this course will definitely improve my knowledge that I have, maybe like tweak some of my skills that I have as well, so that I can only improve. The next question is, identify personal and academic professional goals for this clinical course as you wrap up the or psychiatric mental health nurse practitioner program. So my goals for myself and for this course are just to continue to improve on understanding medication management, understanding proper care plans for this age group, and making sure that I'm able to implement them in practice, understanding what tools are available, what I guess evidence-based practice is available out there, looking at new research, and also just what types of certifications are available after I'm done with the program that I could also pursue that will I could provide to patients once I do begin my clinical practice. And then, are there any specific goals that I have for this course? Um, I would just say time management. Would be my biggest goal. Sometimes I feel like we don't have enough time in the day, but that would be, I think, my biggest goal for this course, and just to enjoy this last clinical session, making sure that I'm able to take in all of the information, making sure that I'm able to use it in my future practice, and just taking the time to just making sure that I am utilizing all the tools that are being provided. As far as like goals, making sure that all of my clinical notes are in on a weekly basis. So nothing too hard. I think that those are realistic goals. So, and the last question is, what strengths or weaknesses have you identified throughout the program that can be remedied in the final course? Um, I would say strengths that I do have are looking at the whole person, and looking at a holistic approach when I'm looking at care planning, care management, and also medication management. I believe that that is a strength. I always love to incorporate those items along with, the medication management, looking and researching, why or what are the current trends as far as evidence-based practice for certain medications with certain age groups, because certain medicines are targeted towards certain age groups, while others may be targeted towards your pediatrics or even your geriatric patients. So I would say that making sure that I continue to learn, and also putting that newfound knowledge within my current practice as well as future practice. That is it. I hope you enjoyed my first journal entry, and I look forward to this course.